Okay, so while we're waiting for Yael to join, we're live, and thank you everybody, both the attendees and everybody for joining. We have here Elise and Mark. I think that Mark is still here, and yes, he is. And we have Scott, we have Rory, and Yael. So it's a full house today. My name is Yair, and we're gonna jump right into it. So I am a physician in the area of Philadelphia, and I appreciate everybody joining us on this special evening. This is the second series in regards to employee or Jewish employee resource groups focused more on healthcare and hospitals. And we have a lot of special guests here. So just to tell you that I'm part of the Hope for Israel Alliance, which is an organization to support Israel and fight anti-Semitism. And just to tell you briefly about some of our attendees, Yael is going to talk. I'll introduce her in a second, but Yael is going to talk about our guests, Elise and Mark from Boston. But just to mention, and I'm going to cut the introduction short because we want to get right into it, but I'll start by introducing Scott. Hi, Scott. Thank you for joining us. Scott Richmond is the director, regional director of the ADL's largest regional office covering all of New York, New Jersey. He oversees work of the region, including incident response, anti-bias education, legislative initiative, educational program, fundraising, leadership development, all of that to really support Israel and mostly to fight anti-Semitism and combat hate in all of its forms. He has also a national podcast called From the Front Lines. He has a lot of, he's been in so many Jewish organizations before, including the AJC and others. And in terms of what he does, other than that, or previously was a practicing attorney and investment banker and before becoming a Jewish professional. So that is Scott. Thank you, Scott, for joining us.
Thank you.
And now I'm going to tell you about Rory, who was like a last minute addition. And Yael, we should just remember that we should focus on some questions to him because he has a hard stop at 8:45. So Rory is the director of corporate initiative and senior counsel at the Brian Center. He's a graduate of Queens College City University in New York, Columbia Law School. He began his career in the litigation department in a prominent international law firm. And then he focused his practice on law on representing employees experiencing discriminatory or unsafe workplaces. So you understand how relevant it is to what we're going to talk about. He has a lot more other stuff that he's been, he served in the New York City Council member, New York State Assembly member from the Borough of Queens, vice chair of the New York State Democratic Party, and much, much more. So thank you, Rory, for joining us. And last, I'm going to introduce Yael, my friend, and one of the fierce leaders here of Yael, who has somehow, the most important thing about Yael is that she somehow invented some sort of a magical potion. She takes a magical potion that keeps her going and sleeping only 2 hours or 2.5 hours a night. No, I'm joking. But seriously, Yael is the head, the founder, the president of the American Jewish Medical Association. She's a plastic surgeon and full-time private practice in New York, amazing plastic surgeon. And she has done so much in the last year that is just unbelievable. So many different initiatives, bringing this group of people together, legislation, Congress, et cetera, et cetera. So that was the brief introductions. Yael, jump right into it.
Hi, can you hear me actually this time?
Loud and clear.
Okay, perfect. You want to share the screen? And I have some slides just to organize us because we have. Okay, great. Does everybody see the slides?
Yep.
Okay, fantastic. Okay, so just to organize us, because we have an amazing audience, many of whom are already in a JERG or want to form a JERG, a Jewish ERG, and many of whom are also members of the American Jewish Medical Association. And this is really one of the first things that we recommend at every institution. And when you hear or pick the brains of Mark and Elise, you'll really understand all that can be accomplished by forming a GERG. And here we go. And thank you for the great introduction, but we are all such warriors, and we are also so capable, and all of this is happening. We're able to affect all the changes we're doing because there really are just so many of us that are so type A, accomplished, and bright. So why do you want to have a Jewish employee resource group? First of all, what is a Jewish employee resource group? Basically, it is your corporation, your medical center, your health affiliated, whatever institution you're working at. It's basically how they are for all of the ethnic groups, be it Latin, be it Asian, be it Southeast Asian. This is how they are actually supporting and allowing the different ethnic groups to really feel comfortable and be the best selves at work. Why do we want to have one at our hospitals and our medical centers? Because it's your local resource. How do we go back a slide? It's your local resource for community. Gives you access to email on your institutional listserv and allows you to host events. You can celebrate Jewish culture. You can have cultural events. You can support Jewish and Israeli students, as well as your junior employees and junior faculty who may not feel comfortable otherwise. And also, one of the reasons why we really want to have it, and Mark and Elise can talk more about that, is this is really with the source that you can be an anti-Semitism committee for your administration. And then the other really important thing to do is educate. And we're going to be talking about all the different speaker panels, forums, grand rounds that you can be hosting through the listserv and through your ERG. So just to give an idea of how many ERGs are forming, there are, oh yeah, these are the older slides. Do you want to share screen so I can allow me to share screen, and I will, if you can turn sharing on. If not, I'll use the older ones, but we have newer ones. There are ERGs now everywhere. Most hospitals are being petitioned and forming them. So this is.
You want to try to share? I made you a co-admin, so you can co-host, so you can share your screen if you want.
Yeah.
And if not, I'll go back to the old ones. That's what happened.
Yeah. So I just want to. Great. Can you guys can see the slides?
Yeah, just do a full. We can see it. Just make it full size, like the little icon of.
There we go.
Yeah,
okay.
perfect.
Good. Yeah. So in New York, effective as of today, Cornell finally got their Jewish ERG. So we have 7 Jewish ERGs that have formed just in the past few months. Massachusetts, I believe you're up to 5 now. So they're forming everywhere. And also, this is kind of our network with each other and can be our network globally as well. And these are just some of the areas that they just formed a group in Mexico and Argentina. So we really can be in communication with medical societies everywhere. I really wanted to have this slide up because I want everyone who's watching this as a recording, and I want everyone to take a photo of this because these are some of the best resources that I found out there. We have someone from Brandeis here tonight, who I'm going to have speak in just a moment. And then we have ADL has an absolutely great toolkit that everyone should see. There's also a resource called JewishERGs.com based out of England, and they actually internationally are helping form Jewish ERGs and have monthly meetings for Jewish ERG leaders. And then another really important source, and this is really one that everyone should be taking advantage of, is Natan has a quick funds grant that will give $5,000 to every Jewish ERG that forms and wants to do programming to fight anti-Semitism. And if you group together with your other in-state or local city ERGs, you really can have amazing programming and multiples of $5,000. So Rory, right now, if you want to take a moment to explain legally who is entitled to form a Jewish ERG, why we're entitled to form a Jewish ERG, who can be in the ERG, who can we or not kick out of a Jewish ERG. I think that'd be really useful because those are the crux of the problems that we're seeing, that we're going to be discussing as we go on tonight.
Yeah, I'm happy to, and I'm really grateful for the opportunity to participate in this webinar and to get to know all of you, and hopefully to be of service as you continue to advocate for the rights of Jewish employees. Let me just briefly introduce the Brandeis Center for those who may not know. The Louis D. Brandeis Center for Human Rights Under Law is a nonprofit organization composed mostly of lawyers dedicated to protecting and defending Jewish life on college campuses, in the workplace, and elsewhere, using the tools that are available to us as lawyers, primarily federal, state, and local anti-discrimination laws, but any legal claim or legal avenue that we can think of to help the people we represent, that's our thing. We're lawyers. I'm the head of the corporate initiative and senior counsel. And my focus is on anti-Semitism in the workplace, and that has led me to spend a lot of time on the issue of Jewish ERGs. I expect to get a lot out of this this webinar tonight and this conversation. But if nothing else, the introduction of the term jerk will certainly make my life a lot easier. I never wanted to use the term erg, but if you put a J in front of it, jerg, it kind of sounds cool, and I'm going to use that from here on out. There is no inherent legal entitlement or right to have a Jewish ERG at your place of work. If you do have a right, it arises from the fact that your place of employment has ERGs at all and has decided to offer ERGs to on a basis of certain of their employees' ethnicity. So if your employer has created an ERG, and that ERG, as most do, has real benefits and advantages and opportunities for the individuals who participate in those ERGs and for that community of people as a whole, based on ethnicity, then Jewish employees cannot be told, well, we don't do religious ERGs. So even though we have a Latino ERG or an Asian ERG or an African American ERG, we're not going to let you have a Jewish ERG because that's a religion and we don't do religious ERGs. And in fact, most companies don't do religious-oriented ERGs. So it's important if you're a Jewish employee at a company to first have an understanding of how your identity is defined, not just philosophically and sociologically, but under the law. Put simply, Jews are not just a religious identity, but an ethnic one. We are a people. We have a shared ancestry. We share common language and culture and history, and very importantly, geographic origin. And so one of the resources that was provided in the earlier slide was an essay that I wrote laying out and explaining why it is that the law recognizes that Jewish people are a people, are an ethnicity. And if your company is offering, or your organization, your healthcare institution is offering certain of its employees based on their ethnic identity, the opportunity to have an ERG, then it's our view, our position, which we're willing to defend, that you as a Jewish employee are entitled to the same opportunity in your workplace and to have a JERG, a Jewish ERG. And as we, issues come up with different nuances and aspects of that, I'm happy to talk about it. But that's the big picture.
Can I ask you a question, a quick question, because is there are several organizations, including local organizations here in the greater Philadelphia area, that have been basically denied or significant pushback, and I mean multiple centers, and for different reasons. Some of them are not explained. Can an institution that is allowing ERGs technically or legally say no to an initiative of a Jewish ERG?
All right, so I'm putting my email in the chat. so that everybody can see and can reach out to me directly. But if you're working for an organization that has ERGs that are based in the ethnic identity of their employees, and I mentioned some examples earlier, African Americans, Asians, Latinos, these are some of the common ERGs, then it's our view that the employer cannot tell you that you, Jewish employee, are only identified as a Jew, a religion, a member of the Jewish faith, and we are not going to recognize you as an ethnicity, as a people, and we are going to deny you the right to have an ERG in the same terms and conditions as we allow other ethnicities. So the individuals who are experiencing that in Philadelphia or wherever in the United States, please reach out to us because we are looking to assist people who are getting that kind of pushback that you're talking about.
I'm happy to jump in here if you want on this particular point, because I help a lot of Jewish ERGs with this. And, I don't always come at it, in a litigious way like that. I often come at it in a way to say, you need to be educated. This isn't just an issue of discretion. This is an issue of who the Jewish people are. And I often play a role of educating the group that's trying to form the Jewish ERG, but also I put myself forward as somebody who can talk to their employers who are not understanding this idea that Jews are both a faith and an ethnicity. And the reason I just want to amplify this a little bit, the reason that they don't understand this is because it's so unusual. There are almost no other people on the planet who have this kind of duality to their identity. So for them, it doesn't compute. You have a nation, an ethnicity to which you belong. You have a faith to which you belong. The idea that those are as one identity. This is not found in almost any other group. I do a podcast, which you mentioned, and I interviewed one of my colleagues about this, and I said to him, "Is there another group?" And his answer was basically no. The closest equivalent are Native Americans. We often think about the Cherokee Nation or the Sioux Nation. We don't think about the fact that they also have a distinct theology that goes along with being Cherokee or Sioux or other groups of Native Americans. So for people who are not attuned to this, which even the Jewish community doesn't think in these terms, we just are both a faith and an ethnicity. We take it for granted. Terms like secular Jew. Now you couldn't say a secular Episcopalian. You couldn't say a secular Lutheran because either you're Lutheran or you're secular. You couldn't be both. But we in the Jewish community take that for granted that you can be both. You could be a Buddhist who's Jewish because you're referring to your ethnic identity. So I often have those conversations and help people understand. And I will also say it's not just a matter of the law. It's also, if we look to the government, Title VI. So Title VI of the Civil Rights Act, we hear a lot about that now because it's being applied. Certainly the Brandeis Center, an ADL partner on Title VI investigations. That's very important. Title VI of the Civil Rights Act does not apply to faith-based groups. And the reason it's suddenly being applied is because it was recognized that Jews are an ethnicity and that the Civil Rights Act can be applied to it. But it didn't start that way in 1964, 1965 when it was passed. For decades, Title VI of the Civil Rights Act was not applied to Jews because it was seen that Jews were a faith-based group. And there's a different section of the Civil Rights Act that applies to faith-based groups, but even the government has now recognized that Jews are an ethnicity. I can put the podcast in the chat if anybody wants to listen to it and do a deep dive into this particular issue because it really is fascinating.
Please do. I mean, we'd like to share it and also several of the slides. Before I pass it to Yael to show a few more slides and ask questions, I'm going to jump into a question that, comes up. I can't tell you how frequently it comes up. When I see people, including my enterprise, other healthcare enterprises, who are really decided to push forward and start a JERG, a Jewish ERG, if they get resistance, what is happening is that the people who are starting it, either nurses, physicians, usually trainees, often are facing fear because if they see that there's pushback and the enterprise for whatever reason is not, you're not instinctively saying, yeah, let's do it, then they push back, and then the employees are thinking, well, I have a family. If I really push hard back and I'm alone, could I get into trouble, either directly or even indirectly in some sort of retaliation? And I'm telling you that this is a real fear. And I know that we have resources. We can reach out to people like Rory and Scott and Mark and Elise and everybody in Yael. But even with support, I think that one of the problems is that honestly, people are afraid, especially when they're getting this fear. And just to mention, before I let anybody answer this question, the first session that we had about JERG with Elise and Mark, they showed to us what's the benefit. It really seems to be a win-win situation. But again, many facilities, enterprises do not necessarily see it this way. So open question to Scott or Rory, what do we do with this fear of retaliation?
I can tell you as a lawyer that all of the anti-discrimination laws that we would use on behalf of a Jewish employee or Jewish employees seeking to have an employee resource group contain very strict and enforceable prohibitions against retaliation for asserting your rights under those laws. And it's often the case that the expression "the cover-up is worse than the crime." It's often the case that a company's retaliation will be easier to prove and more evident than the underlying discrimination that you're accusing them of, or they were accused of. But with that said, I can't guarantee that you will not be a victim of retaliation. I can't guarantee that that retaliation won't come in subtle, but nonetheless significant forms. And each employee has got to decide for themselves whether or not this is the right moment and the right way to address the problem of discrimination that they're facing. Now we can approach it also in more subtle ways ourselves than just filing a lawsuit and hitting an employer over the head. We have many times drafted an appropriate letter to corporate management on behalf of the employees, meaning it will come from them. And we've tried to tone down the legalisms so that the employer doesn't know they've got lawyers on the outside. Every employee understands their culture better than I do as an outsider. And sometimes the appropriate way to approach a problem is with a more gentle touch than rushing to file a legal claim. And that's sometimes where, it might be beneficial for us to turn to one of our partners and say, maybe your involvement doesn't come with the implicit threat of there's going to be a lawsuit. Those are some of my thoughts.
Elise, you raised your hand and
yeah, we've been hearing this a lot. I just want to say, for anyone who needs this, Mark and I have been hearing this from different folks. I think the plan that we've started to put in place is we'd be happy to come in and meet with some of the folks as a group. We do recommend there's someone senior because he and I are both full professors, just because the senior people, I think, don't have that as much of a fear, and it's very good to have a senior person. And then similarly, we're happy to go and meet with their administration when they go and show them, pass along our resources. But I think that meeting as a group first with senior people and then going and showing the data of other places that are doing it can be very powerful. And so far, I think a lot of the resistance is lack of understanding. And so I think that the first few steps is to really try to understand, when you show them the precedents and explain the rationale, does the answer change?
Yeah, I think, can I just add on to what Elise says, and that point about data, gathering data about what's going on in your institution. And what's been, I think, a pleasing thing is there was a recent report by Schwartz with regards to surveys done of the Jewish community in healthcare, reporting the actual, findings of surveys. And we started very early with doing surveys of our membership with regards to their experiences of their Jewish identity in healthcare, concerns about fear of in the workplace, concerns about anti-Semitism in the workplace. And I think gathering data you can do in surveys. And we have a survey which Elise designed, which we would be happy to circulate as well, to capture your, proto-ERG memberships experience. And then the second piece with the listening and support sessions, even as a proto-ERG, we were holding listening and support sessions for Jewish staff so people could actually vocalize what they were experiencing in the healthcare system. All of these things are important because then you can report back both statistics, but also actual written free text experiences that people are having with regards to both the experience of their Jewish identity in the healthcare institution and their interactions, anti-Semitism or whatever that they're experiencing amongst healthcare staff. And one of the things that I think was surprising to us, because the institution was worried about patient on healthcare professional anti-Semitism, that actually the majority we found was between healthcare professionals. And I think those are the types of things where data really matters. And other surveys now have borne that out in other institutions.
Yes, and actually I want to give a shout out to Dr. Daniela Schwartz, who did publish the first study, and then another study actually came out today, also from members of the Journal Publications Committee from the AJMA, it's publicized on Stand With Us website. So there are 2 published surveys on anti-Semitism in healthcare. So yes, while I still have Rory and Scott have legal minds, and here, you talked about, and I'm curious if for all of the panelists, if this is something that you have seen, what we're seeing is in some institutions, they're allowing a Jewish ERG, no problem. They understand its ethnicity. In some places, they're allowing the Jewish ERG and then announcing religious ERGs. So what, should the Jewish ERG make a stand at the institution and say, well, just to be clear, we're not a Jewish ERG, we're a cultural ERG, or should they just be happy that they have an ERG?
Let me make a legal observation and then a practical one. The legal observation is that, as I said at the outset, Jewish employees represent an ethnic identity that is entitled to an ERG on the same terms and conditions as other ethnic identities. So that means if there are other ethnic identities that their own full-blown ERG, then Jewish employees are entitled to the same thing on the same terms and conditions. If there's neutral criteria that has to be met, like you need, 100 employees to sign a petition or whatever it is, that you're entitled to. As a practical matter, we have spoken with, and I'm interested if others have different experience in this, we have spoken with many, many Jewish employees at major companies who have been forced to join an interfaith ERG and maybe have like a Jewish subchapter or something like that. And it has never, my experience, it has never worked out well for the Jews, in that interfaith ERG just becomes a microcosm of whatever problems are existing at the larger corporation. And the Jews find themselves in this ERG fighting for attention, opportunities, speakers, et cetera, et cetera. But maybe others have a different practical experience.
Yeah, we actually were asked to help, and we did help them start the Muslim ERG, and then a Catholic ERG just started. So the other thing is, it's a strength to actually have separate ones, because the truth is the different religious groups, particularly Muslims and Jews, need their own support system. But I think the thing that did help us is we have spoken to them. We see them at meetings, and we have talked to them about doing things intergroup events or discussions when everybody's ready. But I think saying that we want our own, and that would actually, as a strength to later facilitate interactions between all the groups is great. I mean, we didn't know that they started a Catholic group. They just did because they were excited. So I think people enjoy having these religious affinity groups at work, and it's a strength. So if you need to cite us, go for it. People are really excited. We'll let you know what new religious group pops up, but they're excited.
It sounds like you're describing a scenario where each group does get its own ERG, as opposed
Yes.
to an interfaith group, which they all need to somehow coordinate and cooperate.
They never recommended to us interfaith. At this point, that would be kind of that would be unrealistic, but they did say to Mark and I when we were starting it, we'd like to start, the overall ERG structure didn't have a Muslim group yet. And Mark and I said, we're happy to modify our survey for them. We're happy to share with them. And so I think also our reaching out and saying, we're happy to help the bigger infrastructure understand how to start religious affinity groups was something that they were very excited about as leadership. And I think it showed them that this was a positive thing.
I'd like to make a comment here and go back to the idea of this interfaith affinity group or interfaith employee resource group. You know, you can start off in a different way because a lot of this is about education. And, you know, you have this idea that people don't recognize the unique Jewish voice because typically Jews are sort of lumped in together with the white presenting majority, which of course it's not an appropriate way to be seen. I mean, this is the whole argument with DEI, that DEI puts Jews in the white presenting majority, and it sort of negates the very unique history of Jews, the unique history with anti-Semitism, persecution, and unique history in general. It also, of course, doesn't take into account the fact that 15 to 20% of people in this country, or Jews in this country, are considered to be people of color. Or, you know, in Israel, it's the majority of the population are people of color. So, you know, you could start off in a different sort of way. You could be a Jewish group that is not necessarily an ERG, but a Jewish group that looks to educate people. I do a lot of corporate training. This is a big part of my work. I'm brought in by many big companies. I've been brought in by several hospitals, as well as medical schools to do this kind of corporate training, but also well beyond that. L'Oreal, Bank of America, Etsy, Peloton, Saks Fifth Avenue, a lot of companies have brought me in. And a lot of the conversation is around this idea that there is a unique Jewish history and unique Jewish voice that means we should not be lumped in together with this majority population. And educating people on this is a much more organic way to arrive at a Jewish ERG than to come in a strong way and say, you must do this, because this is sensitizing people and helping them understand where Jews fit in. It's not, you know, the faith and ethnicity piece is one aspect of it, but the idea even of anti-Semitism, people see social prejudice through their own lens. So if you're Black, you see it through the lens of racist. You know, if you are Latino or Muslim, through the lens of Islamophobia. Anti-Semitism looks nothing like those forms of social prejudice. So this is also a big piece of what I talk about. I talk about the conspiracy theories, the building blocks that make up anti-Semitism, and how that doesn't look like any of the forms of social prejudice, and that those conspiracy theories have been in existence for thousands of years. It's a very unique history. And when people come to understand that, they come to understand the fact that Jews are coming into this space with a very particular identity that needs to be recognized. It's a much more organic way to get to this goal of an employee resource group.
And I just want to riff on a little bit about that to connect to Elisa's point, because there is a very significant role here for what we see is, wherever possible, the educational component around anti-Semitism or just being Jewish, because one should never assume that anyone else outside of, you know, being Jewish is actually that remarkably interested in it. And so the ERGs offer an opportunity for this kind of key word of intersectionality, both for Jewish ERGs. We have members of our ERG that are in the LGBTQ ERG, or they're also in the LGBTQ community or in the African American community or the Hispanic community. So that there's so much to educate. And I've definitely spent time with DEI explaining the diversity of the identity of Jewish people that come together in an ERG. And I found it most remarkable that when certain Jewish members of the LGBTQ ERGs were feeling isolated and ostracized because of the events of October the 7th and thereafter, that they found haven in the Jewish ERG. And I think that's very important for not for us to just take on, but to educate about what that actually means for people who have Jewish identities.
Great points. I have two legal questions since we have Rory and Scott here. But I'd love to hear also, of course, Elise and Mark's your experience. So the question is, in at least two of our esteemed institutions nationally, actually, I'll call them out, Hopkins and Brown, there are Jewish voices for peace, though I think everyone on this webinar is a Jewish voice for peace. I think all Jewish healthcare professionals are voices for peace. Have kind of, even though I would say they're definitely a minority of Jewish voices, have sort of hijacked and taken over the narrative of what's being done at the Jewish ERG. Can you speak to maybe strategies how to handle that, and what is the legal ramifications of a Jewish ERG? Can some people be members? Can some members kick out other members? On what grounds would they be doing that? And, for instance, can a Jewish ERG vote who they want to be leading it? We also have another institution where the institution created an ERG, but appointed two leaders. There's no voting. There's no consensus discussions on what the Jewish ERG wants to do. How can we legally, what's kosher?
So the legal aspect of my answer will be relatively brief, and if I had the time, my political background would be more appropriate to answering that question. The workplace is the workplace, and the Jewish employees, how they identify themselves in that workplace, are going to be entitled to participate in that ERG. There cannot be a litmus test other than in the very, very broadest, most liberal sense of who's Jewish, not Jewish, but short of somebody obviously engaged in a sham, they're going to be allowed to participate if they identify as Jewish. You're not going to have the ability to put a requirement of that they be Zionist. You're not going to be able to deny participation to someone from like a Jewish Voice for Peace or some other anti-Zionist organization. If you want to only associate with people who have your views, that's what an organization like yours is for. And in terms of your right to choose your own leaders, again, because there is no inherent right to have an ERG, a Jewish ERG, it only depends on your having rights that are equal to others that are being offered ERGs. Whatever the company policy is, and different companies have different policies, it just needs to be applied equally. So if the Latino ERG, their leadership is appointed by management, the Jewish ERG has no right to say, well, we want to elect our leaders. I will just say that if you feel that management is manipulating the structure, leadership, etc., of the ERG to effectively squelch the anti-Semitism concerns of the members of the ERG, that's something I'd be interested in talking about and trying to get more details on. But it is really one of those situations where the answer is most likely not going to be found with lawyers, but in the small p politics of the organization and making sure that the right people show up at the meetings and express themselves. I don't know, Scott, you have a different, is that your experience or?
I don't have a different point of view, and I want to put a little bit of a different cast on it. What you are essentially asking for, Yael, is to cancel people. And you really can't do that in this context. And this is a larger conversation about free speech that I have all the time. People are
Just
constantly.
officially, I'm not canceling anybody. I was just asking the question.
No, I know, I get that. I get that. But if you're sort of saying that this group of people are entitled to be part and this group are not, that's not it's not the way I would recommend doing it. We generally like I get so many nervous parents who call me and we have to cancel that professor or cancel that speech and my answer to them is always the same, and it would be my answer in this case. The way we deal with what we consider to be bad speech in this country is with good speech, with counter speech, with counter arguments. So, you can have discussions about this. You can, bring forth speakers who present more mainstream points of view. You can even have conversations about the fact that the point of view that Jewish Voice for Peace is presenting is not a mainstream point of view within the Jewish community. That is not your opinion. It's a fact. It's a very marginalized point of view, a very minority point of view. But you can't cancel that speech. You can just speak around it.
Let me ask, I know that Rory has to jump off in a couple of minutes, and kind of as a follow-up to this question, and also to the whole concept of ERGs, of Jewish ERGs. Some may say, maybe it's not that important, because, for example, one of Yael's friends and colleagues from UCLA, her name is Kira Stein, and what they have done over there in UCLA is truly unbelievable. Yael, Elise, and Mark were with her on a Zoom conversation, and she just talked for 30 minutes, and we were shocked because what she created over there in all of UCLA is a giant affinity group, JFreg. So it's not something that is an ERG. It's not directly connected or sponsored or has any ties to the institution, to the enterprise, but they have a very powerful, and we're actually going to have a separate session with her and with her people because what they've been doing is so amazing. So why do we even need ERGs? What is the benefit of having an ERG rather than just a powerful affinity group, a JFrag?
Well, what an ERG allows you to do is to avail yourself of the support, the funding, the institutional channels of communication that a company has established and that other groups of employees in the company are deploying to their advantage. UCLA is a public institution, so I know Kira very well. She has, and those folks have more protections than do employees in a private institution. So if you have a company that has said, okay, we are going to allow employees to organize in a particular structure, we're going to give them funding, and we're going to make available to them the ability to communicate to management in ways that just Joe or Jane employee doesn't have. I think it would be a mistake not to avail yourself of that opportunity, of that structure.
Yeah, could I just add, having spoken, as you said, with Kira Stein, I think whatever works in the local environment works. I mean, in many ways, the proto ERG was an affinity group until it became an ERG. So it does have these sort of administrative advantages, but if a affinity group like they've formed at UCLA works and is addressing the concerns of the Jewish community within that healthcare system, all power to it. And I think that's where, the metrics of what, it's all very well having a Jewish ERG. What are the metrics of its interaction with the Jewish community and Jewish affiliated community in the healthcare that ultimately really matter? And Kira, what she's done at UCLA is clearly impactful in the context of that healthcare system.
Yeah, you're on mute. You're up.
Yeah, I don't know if I'm sharing my screen again with everybody.
Yeah, just make it bigger, like a starts, slide presentation, but we can see it.
Okay,
Yeah.
good. Well, just to go back, just to emphasize the slide, and these are, and Mark, if you want to comment on some of the things, these are some of the reasons, just as Rory was saying. You want to have a ability to use that institutional listserv. You want to host events, and funding. Sometimes there's funding available, and as I put here on this side of the bottom, Natan is an outside source, but sometimes the institutions themselves are giving money. Mark and Elise, I know you guys created a mission statement, I believe, for your Jewish ERG. Rory, what do you think about having mission statements? Scott, what do you think? Is that a good idea to do? And we talked about allowing all speech, and be it minority members of the Jewish world. What should the mission statement kind of say? I kind of wrote down some things here, but
I'll give you the legal answer, and then let Scott give, obviously if he wants to give a legal answer too, but like more the I'll call it the political answer, but I say that in the good sense. The legal answer is it should be as broad as possible. You're going to run into legal problems. You're going to create problems for yourself. The more restrictive the statement is in terms of who can participate and what your goals are. What's articulated on the screen here seems to me appropriately broad, but also focused. Beyond this, I as a lawyer, I might exercise caution.
Yeah, I don't have too much to add. I mean, first of all, if you can agree on a mission statement, that's your first step. You might never get there, and that may scuttle your effort at an affinity group, an ERG, whatever it's being called right from the start. You may want to create a mission statement down the road after you've had several events, several meetings under your belt. And actually, just going back to the prior idea about the importance of an ERG versus an affinity group, I mean, this is sort of like an institutional sanction that you are receiving by being an ERG. So money and administrative assistance is important, but it's even more than that. How does one find the Jewish affinity group if you are not really part of the system in that way? How do you access that? Whereas an ERG is part of the system. It could be housed within the DEI framework, especially if it's a very large institution. It may not be so easy to access this. You're a new employee. You're not necessarily introduced to the Jewish affinity group. You may be introduced to all the ERGs and not see one that fits your identity. It goes beyond just the practical implications there. Like it has that kind of institutional sanction and would be much more widespread.
That's a phenomenally important point, is that you can advertise and they can advertise you, so that more members could potentially join, which leads me to the next slide, which is particularly at institutions that we have so many in healthcare. We have so many people who can be part, and we see that in the AJMA, and I'd love to hear, Mark and Elise, your experience, because actually on the panel, I'm an MD, here's an MD, Mark, you're an MD, you also do research. Elise, you sit in multiple departments and wear multiple hats. How successful were you in getting everybody to be part and representing them?
I would say from the get-go, we got representation from most of this list. And I would just stress that a lot of that occurred by word of mouth more than any sort of, as you know, we all suffer in healthcare from endless emails informing us of everything at all times. And so any advertisement for a Jewish ERG is just lost in 400 other messages that week or even that day. So we have technologists, we have technicians, social workers, chaplains, dietitians, doctors, nurses, dentists in our list. And I would just say probably the most we wanted to be on this for this point, which was the trainees. The Jewish trainees are the most vulnerable in the system. They feel the hierarchical system the most, and then if they're ostracized or fearful, they're reluctant to report it because they're concerned about retaliation or impact on their career development. I've had to deal with a number of those sort of situations for Jewish junior members of staff, and whether it's perceived real or not, there's a very significant impact on Jewish trainees currently in healthcare that we in the Jewish ERGs, I think, have to really pay special attention to, because it's sort of like a otherwise kind of potentially suppressed group because of the real hierarchy that exists in healthcare, where the junior staff are looking for their next job and therefore don't want to speak out against ostracization or fear because it may impact their job prospects. And hence, Elise and I are, faculty, senior faculty, and, we have a sort of level of confidence that, we're going to be able to be heard and listened to. But the junior staff in all of these categories are ones that we want to reach the most, frankly.
Folks, I have to run. Thank you so much for having me.
Thank you so much, Rory.
Thank you, Rory.
Thank you.
Insightful. One of the things we did at the beginning is we divvied up and we reached out to different department heads. So you had to be careful. It was word of mouth because we're also seniors, so you don't want to be perceived to be asking someone who reports to you anything, So what we did was we emailed different department heads and asked them if there are people in their department that they thought would be interested in kind of spreading the word. Let them make that decision, whether it's a junior person or whatever. I did have one colleague who sent a very nasty email back to me. And I was a little surprised, but so we just kind of relied on that and let people make the decisions. The other thing I want to really emphasize is two things. In our mission statement, in our communications, we don't just say Jewish people, we say people who identify as Jewish or with Jewish communities. And we also make very, very, very clear this is not political. We're not interested in political stuff if it comes up at meetings. So we basically say it's for people to connect to a Jewish community at work. And so if people get angry with that, I think that's a different issue. And they can also choose not to be part of the Jewish community. But there's nothing in our outreach at all that that confers anything political, and we're very, very clear about that. If at any gatherings or anything becomes political, we shut it down right away. And I think the truth is that people who really are interested in different political issues on the sides are not going to find what they want in the JERG.
Mark, Elise, and Scott, I'd love your inputs on this next slide. Congratulations, you have the Jewish ERG. How do you organize it? Mark, you commented, and this is actually why the AJMA has been so helpful to Congress in their work in investigating our institutions at the Energy and Commerce Committee is documentation, is having a database. How are you? So many of the incidences do get reported to AJMA, and we have a big, enormous database. ADL does too, and we're working with ADL to, make sure that we're covering all of the database cases that come in. Also, Stand With Us. There are. I put a template structure here having, I guess you guys are the co-presidents. Do you have a secretary? Having a liaison to like the bigger national group, having a liaison because you guys, because your senior faculty are so influential, that the administration will listen to you. You're kind of the de facto anti-Semitism committee for them. Do you have a junior faculty who's specifically doing the outreach to students? Or are the two of you doing everything? We have so many members who are sit on the board of the ADL or the Federation. Do you have an official appointment? And if you guys also want to comment on, I think Kaloniot is a really amazing. We have so many committees and so many initiatives at AJMA, and there still isn't enough. There's Kaloniot. So here's a lot to cover on this slide.
So I would just say that creating a broad leadership group is really important. We're part of this Mass General Brigham system, so there are multiple hospitals, and what we've sought out are leadership from each of the hospitals or each of the departments, including the administrative component and so forth. So it's important to spread the leadership of something like this across your healthcare system. So there's multiple inputs of opinions into what you're deciding to do, and then multiple ways that you intersect with different communities within those hospitals. And we've been in existence for over a year, and I would say at this point we are further developing those liaisons with those other hospitals in our system to make sure that whether there's a small Jewish community there or a large Jewish community, they feel connected to the hub. And then the last thing I would say is we're also aware of the network, AGMA, ADL, JCRC, and so forth, and where people are, it looks like we can advise our community to go for help in different places. We'll advise that. If reports come to us that require, let's say, HR at MGB to address, we won't deal with it ourselves. We'll direct the issue to the relevant senior management in HR, in security, in the division or department, and so forth. So we're sort of like we sort of sort out the issues and try and help. I mean, we help direct people if they say their children are suffering anti-Semitism at school and they don't know what to do. We'll direct them to the relevant national organizations that address anti-Semitism. So we're sort of like a clearinghouse for issues that our Jewish community and our healthcare system are experiencing.
I want to be mindful. Oops, sorry, Elise, go ahead.
I just want to say in terms of the administrative stuff, Mark, there's someone in Mark's lab who helps, who's wonderful. We also, I have a college internship program in my lab, so we kind of use that same philosophy, and we've worked with some college interns, but otherwise it's really all volunteer work on our part and the whole committee.
I just want to quickly jump in on the issue of incidents and reporting incidents, because very important point here. ADL tracks incidents, but ADL also responds to those incidents. It's a very bespoke kind of approach, where this is the work of my team, at least in New York and New Jersey. And, we have 25 offices across the country. They're all responding to incidents. You can report those to adl.org/report incident. So, a lot of times people focus on ADL's role in tracking this stuff, which is very important. Data drives policy. And for us, the ability to approach elected officials and approach university presidents or whoever it happens to be and say, you have a problem, here's the data, matters. So very important to report them to us just for that purpose. But that's not all we do. We respond to those incidents with a lot of tools at our disposal and a lot of relationships that we've built to be able to do this over 111 years. So, please report those incidents to us. It's very important. adl.org/report incident. Or you can just go to adl.org and click on the report incident tab on the website.
I want to ask you a follow-up question, Scott, and it's actually directed to the rest of you. And I'm going to go back because I'm mindful of the time. We have about 14 more minutes. Going back to what many people are facing, physicians, nurses, physical therapists, etc., who are working in healthcare enterprises. They really, really want to create Jewish ERGs. They think that it's important. But going back to the problem of challenge and how to get the institution to agree. So I can tell you that from my experience in our enterprise, we started it. There was a group of us who started it. But what I learned from you, which was partially our mistake, is that we didn't have somebody who's a very senior, full professor who maybe is towards the end of his career, and he has less of a problem taking risks rather than myself, who was associate or an assistant professor. And I do agree with you, and I think that it's a very important point. Takeaway point is that if you are approaching your institution and trying to get a Jewish ERG, try to find somebody who is very senior who can help you in the process. But the question is, Scott, I'm sure that you know Andrew Goratsky, who is the regional director of Philadelphia. He helped us a little bit in terms of phrasing the emails and writing a draft of the email of what should we write. But again, the question for you is, what do we do when we face challenges? Sarah Lowe, who was, I think she just had to drop off this, she's from CHOP, and they have really tried hard, and they just got an email saying, sorry, without any explanation, rejection. In our case, it's just a very slow process, and they're pushing back. My question is this: what other challenges, how do we face these challenges? Because this is such a real problem. And maybe, Yael, you can share with us other challenges that other systems have experienced, and how do we deal with these challenges? An open question.
And I just want to say, we met with Sarah yesterday. We're actually going to meet with them. The issue is that they said no because they have one multicultural group for everybody, and we're going to address that. But I just want to tell you that there was a reason behind that no, and we're going to work on to help meet them in the small group and the big group to educate them about a faith-based ERG.
Yeah, and the only other thing I would add, obviously you have to get to the heart of the issue. So in this case, this was the reason that they gave, and you have to somehow go up against that reason, whatever it happens to be. Very often the reason is that you're a faith-based group. We don't offer ERGs to a faith-based group. That's a very common response. But and we talked about that before and how you would respond to that. One thing I could say though is that you mentioned that Andrew assisted with language. Andrew is my colleague, so he's the equivalent for me and the regional director for covering Philadelphia and Delaware, or Pennsylvania and Delaware. And it could be even more than that, because if you wanted us to, we could speak with the employer. We could also write a letter to the employer. ADL has a big voice. Nobody wants ADL's voice somehow embarrassing them. Nobody wants to see a letter from ADL come in. So, it does carry some weight. We're not a law firm. We don't come with the weight of the law, but we come with the weight of the sort of moral conscience of the American Jewish community. And people do think twice when they say, oh, wow, ADL is involved. So, this becomes another incident. You would report this exactly the same way if you're looking for our help. Just go to adl.org/report incident. That's the way to get our attention, no matter where you are across the country. The closest ADL office based on your zip code is going to be in touch about the issue that you have put forward to us.
Right.
Could I just switch back to Yael and the Kalaniot? But since we've got a limited time, but I think it's worth speaking up about this. So Kalaniot's mission, and we're now in formation of a sort of a Harvard Medical School chapter. We're just in that process. This is separate from the Jewish ERG, is to emphasize Israel-US academic collaboration. And we recognized right from the beginning in our system that there were Israeli staff in the hospital who felt particularly fearful and ostracized after October the 7th in the hospital system, and they became members of the Jewish ERG. But we also became aware as US academics of a significant academic boycott going on between a lot of institutions around the world, academic institutions and Israeli academic institutions. And Kalaniot is an organization started by Ernest Frankel at MIT to address that in a very constructive manner, with exchanges of science, exchanges of knowledge, exchanges of people, postdocs, students, and so forth between Israeli academic institutions and US institutions. And just to give you a vignette of what this is currently like, is we heard from a student who was affiliated with an Israeli institution at a biomedical science meeting in Europe, in a Western European country, was harassed by other people at that meeting because it said, the name of their institution and Israel. And this is happening in in the scientific community, which is in the context of biomedical research, is absolutely shameful. And Kalaniot is doing that. And as I said, it's separate from what we do at Jewish ERG, but maybe some of the people on this call will be interested in the fact that there is now an organization that's expanding across academic institutions in the US that's addressing this sort of academic boycott that is going on at this time.
Thank you, Mark, for mentioning Kalaniot. And it's unbelievable how many organizations. I mean, AJMA didn't exist before, Kalaniot didn't exist before, and we work so much with the Israeli Medical Association, but there are so many different initiatives. Another great organization is APF Med, which is American Physician Friends of Israel, whatever it exactly stands for, and they on medical missions. And they're it's important. It's great that we have all these organizations now. We have the AJMA, so we can all be in contact and working synergistically together. And Kalaniot is not just for medicine and health sciences, but for faculty throughout the different fields as well, to make sure that we have allegiance with the universities. APF Med, great. Thank you for putting that up there. I was just answering a question about whether as a requirement for membership in the Jewish ERG, you can have everyone pledge allegiance or adopt or accept the IRA definition of anti-Semitism. And Scott, maybe you could comment on this. I discussed this earlier today with Rory, is that you can't exactly, it has to be open to all Jewish members, regardless. Like there can't, and if you put it into a mission statement, you're kind of maybe opening yourself up to legal challenge. But pushing for the IRA definition to be adopted by your institution would be exactly the type of work, I would say, that a Jewish ERG would be doing, because they are advising their company, to their institution, their health center, to fight anti-Semitism and be aware of Jewish needs and Jewish biases, and to help their Jewish staff. So wouldn't that be the right tack to take?
Yes. I mean, there's nothing wrong with it. There's nothing wrong with encouraging your institution to do that, educating people about the importance of adopting the IRA definition, explaining that it's the most widely used definition of anti-Semitism, explaining that it's used by many countries in Europe, that it's used by our government, and their efforts to adopt it, sort of system-wide, and many entities within the United States have adopted it. So, for example, Yael and I both live in Westchester, and Westchester as a county has adopted the IRA definition of anti-Semitism. So, one could explain all those things, and one can even explain it as a program that, the ERG puts forward. The only issue you're going to encounter is if you have disagreement among the members of the ERG. And if you're going to create some sort of divisive atmosphere within your ERG by doing that, it's not illegal to do it, but if not everybody agrees, I mean, we at ADL use the IRA definition. That's just who we are. But there's a lot of controversy around that that definition, and we see, for example, we're helping with legislation in New Jersey. I'm the director for New York and New Jersey. We're helping with legislation in New Jersey to have it be adopted. Now, there are many groups that are standing up against that. So, it may be a very divisive issue for your ERG, and if you're trying to keep your ERG together, and it may be a divisive issue for others within your organization. Maybe you don't want your ERG to be attacked in that way. So maybe you want to take on issues that are less divisive. I mentioned I do a lot of corporate trainings. When I do those corporate trainings, I always have the same conversation, which is, your presentation won't be political, will it? I mean, they're expecting me to give a presentation about Israel and justifications for Israel to defend itself, and I don't know what they're expecting. And I have to always respond, no, this is a presentation about anti-Semitism and the history of anti-Semitism and the way it manifests, and why it's been manifesting in this way, and how non-Jewish staff can be allies to the Jewish staff, and all that kind of language feels very comforting to these corporations. But if I really were to come in and talk about political issues, it would be very divisive. So they find it to be a much safer place to be talking about anti-Semitism as a form of social prejudice. Nobody can really contest that.
Yeah,
And just
But of course, you can't talk about anti-Semitism without talking about Israel and Israel-related anti-Semitism, and it's always a part of what I talk about, but I couch it in such a way that it's not problematic, I don't think.
I think that, again, there are so many other venues besides a healthcare institution to debate the definition, and it's there on the US State Department and White House websites as the definition that the government is using. And so it's like, to Elisa's point of keeping us out of politics, there are so many venues for people to debate that outside of a hospital. So that can be where it's debated. And what we have done is inform, just that it exists, that definition exists without saying anything more about it. And that, and I think that's important for people to know. I mean, again, data is important. 85% of the Jewish community in the US feel a strong affiliation to Israel. That's important. And one has to be aware of that sort of data when you're thinking about that type of issue.
one more thing that I wanted to just say, and then I'm going to pass it to Yael to conclude the session. It's kind of like to be on the other side of the, we're talking about ERGs versus the affinity group. One of the things that Kira said is that with an affinity group, from what I understand, you're more in control who you want to join. It's not, the JERG is basically, like you said, you can't exclude Jewish people because they are vocal and JVP, etc. But the problem is with the JVP people, as we know, all of us who are on multiple WhatsApp groups, sometimes there are several people, even though they're a minority, but they're extremely vocal, and they really cause animosity and hostility in the group. So just something that I thought that maybe it's an advantage of the affinity group.
Well, I just want to say, because I read that the hospital system we work with has actual codes of conduct of the members. The ERG is not meant to be like a contention. So people who come to it, in other words, the credo of the hospital and the guidelines cover the behavior of the individuals just as much as they're in the hospital as they're in the ERG in the hospital. This isn't a combative space that we're creating with an ERG, and the same rules would apply in the ERG that would apply in the corridors of the hospital. That uncivil discussion of these types of issues would not be allowed in the hospital. We're meant to treat everybody equally and fairly and all the rest of it without that type of disputation. And I would say hospitals are well covered generally with credos that make sure that anywhere in any space, that type of hostility would not be allowed, or would certainly could be reported.
Uh, and actually, that's a good lead in to some of the things that a Jewish ERG can do and can be promoting, and events you could be hosting on campus. I wanted to remind everybody, as soon as you have a Jewish ERG, now is a good time, even though it's months and months and months in advance, for Jewish Heritage Month, which is in the month of May. And we have really amazing, beautiful, inspiring stories for every single day of the month, featuring another Jewish doctor, of which we have so many Nobel Prize winners and scientists. So that's just a little thing that really will instill pride. And that's, there's a lot of positive things that we want to be doing. I also wanted to make sure that we mention curriculum, because Mark, you were just talking about civil discourse and the complete lack of civil discourse. And I don't know if it's because they went through the pandemic, they have no idea how to engage with other people, but there seems to be such a complete lack of that. And so we do have the curriculum. And as soon as you have your, as soon as you have your Jewish ERG and you have your liaison committee to your administration, a big feature of and ADL also has a beautiful Jewish identity and anti-Semitism lecture. Many of our organizations really do. But what's key and goes very well with what we developed at AJMA, which is civil discourse, medical ethics, and critical thinking. And those are really important pieces that seem to have gotten lost. And I urge all of you to become part of the curriculum committee, so you can, we're going to be doing another run through later this month, so you can really promote that. Here are also some of the sample seminars and webinars. We have an enormous speaker list. Scott, you're on this list because you did an amazing webinar with us. These are just some of the things that you could be having at your own campuses. Mark and Elise, I'd love to hear what have you guys had any speaker events yet or ground rounds, and how was that received, and did you get pushback?
So we've had, I think one of the things we want to educate is about the different identities of Jewish people. We had eminent a Jewish colleague whose originally family is from Iraq. We had a Jewish person whose family was Hispanic, a Jewish person whose community comes from the LGBTQ. So we've been, I think, one of the things we wanted to educate about was the diversity of the Jewish community, which is, I think, quite poorly understood by the general community. They just, I've generally seen sort of jaw-dropping moments when I've mentioned even the diversity of my own family in terms of where, family origins and so forth. So I think in addition to all the things you mentioned, I think that's another one that is very important. And then we're planning, a seminar or symposium on anti-Semitism itself in healthcare, which we would hope would attract more than just the Jewish community. Or do you see what I mean? I think it's important for us to do outreach into the general medical community, and I wouldn't have characterized much as pushback as just the usual to and fro of discussion that occurs when you bring up any particular issue in a hospital. It's not, you have lots of different opinions, basically.
Well, listen, everybody, we're 5 minutes after time. I wanted to thank again Yael for putting this together and connecting everybody, and Elise and Mark and Rory and Scott and everybody. This has been an unbelievable discussion and conversation. The recording will be available in the next few days and will be on the AJMA website. I would encourage anybody and everybody who's not part of the AJMA to register and join. And just the last thing that I'm going to say is, in a few days, this coming Monday, we're having the last webinar for December with a special guest of Hetty Wald, who is unbelievable. She's a fellow of the Lancet, and she really is an amazing expert on anti-Semitism, Holocaust, and she's an exceptional speaker. So stay tuned. Thank you, everybody. Toda rabba. V'laila tov. Thank you, everybody who joined us.
Thank you so much.
Thank you, everyone.